Hi, my name's Mandy. I am in the BSN program at the Lock Haven University, and we are going to do a head-to-toe assessment today. Today, this is my patient, Patricia Rolls. So today, we're going to do an assessment in the home, and unfortunately, we're not in the clinical setting, so I don't have the gloves, I don't have the blood pressure cuff, but we'll make do with what we have. So again, I'm going to provide the patient with privacy. I introduced myself as her nurse, and I'm going to explain to her now what I'm going to do. So typically in a clinical setting, I would wash my hands while the patient is able to observe me doing so they don't have any questions. Then I would don my gloves, and now, since I already explained to her the procedure that I was going to do a head-to-toe assessment, we're going to proceed with it. She's 60 years old. She is a white female. Initially taking a look at the appearance of the patient, and we can see that she currently is in no distress, no grimacing of the face. She doesn't seem like she's in any acute distress. Now I'm going to do a quick assessment to see if she's alert and oriented. So the first thing I'm going to do is ask her, Patty, do you know what today's date is?
Yeah, it's the December 5th.
Do you know?
Yes, Donald Trump.
Do you know where we are right now?
Yeah.
Where are we at?
At your house.
Okay. And what are we doing today?
Head-to-toe assessment.
Alright, so with them findings, I can say that she's alert and oriented ×4. Person, place, time, and situation. I'm going to check your head right now. So we're going to check her head. We're going to look for any lumps, any asymmetrical issues that could be there. We're going to check her ears. We're going to check for infestations. So I'm going to go ahead and currently do that. So again, I have gloves on. So I'm looking and I'm feeling, palpating the head, and I don't feel any lumps. I don't see anything, no infestations. I'm going to look behind the ears to make sure there's no open areas. And then I'm going to have her look up at me a little bit, and I'm going to feel both sides of the ears. And I don't feel any lumps, masses. I'm going to have Patty look at me, and I'm going to assess her face is symmetrical on both sides, which means they're equal, there's no issues. So right now I'm going to assess for lesions under the hairline. And she does not have any. So now I'm going to palpate the jawline and see if I can feel any lymph nodes that are swollen. I'm going to go behind the ear and feel for lymph nodes. There's none. So the lymph nodes come down into the clavicle area. I'm also going to palpate down through there. And again, there's no swelling, so we're good there. So I'm going to have Patty look at me, and I'm going to look at the nose area, make sure there's no postnasal drainage or anything like that. So for this, I'm going to use my pen light, and I'm going to have you look up a little bit. I don't see any issues there. So now I'm going to do her look. We're going to check the eyes, and we're going to see if she has reactivity to the light. And they are perfectly round and reactive to light. Dentures? You do? Are they top and bottom or just top?
Both.
Both. Okay. Now I'm going to have her open her mouth, and we're going to assess for skin color, lesions, moisture. Uvula is completely midline, like it's supposed to. Go ahead and stick your tongue out for me. And there's no lesions in her mouth. The tongue is pink. There's no white areas. So I don't see any leukoplakia. I don't see any thrush or any signs of that. Her mouth is slightly dry in the area. So this is whenever I would educate the patient, the importance of hydration. So right now I'm going to assess the joints of her jaw. So I'm going to palpate here and ask, can you open your mouth? Close it, open, and close it. So I didn't feel any popping, crackling, or any inadequate issues. So now I'm also going to palpate the shoulders and feel the joints of her shoulders, which they don't feel swollen. Can you lift your arms up for me? Yeah. Go ahead and put them back down. So they're not swollen or any issues there. So now I'm going to start feeling her neck. We're going to look for tracheal deviations, and I'm going to start auscultating after that. So I'm going to have you look straight ahead, and I'm going to just palpate. So to check the pulses, you only do one at a time. You can't do them both at the same time. So that pulse is good. I'm going to go over here, check this pulse. And that pulse is good. So now I'm going to feel down the line and see if I can feel any lumps. No lumps there. Down the jawline. Now we're going to go down the tracheal line. No lumps there. So I'm going to have you look up just a little bit. And right now you can see that the trachea is completely symmetrical. No lumps, no nodules that I can feel. And it's midline. There's no shift. So now I'm going to palpate the clavicle area and make sure I don't feel any nodules, lumps, or anything like that. And I don't feel anything. I'm going to use my stethoscopes, and we're going to check both sides of the carotid artery and listen for a bruit. So at this point in time, I'm going to have you look straight forward, just normal, and then take a breath in, let it out, take a breath in and hold it. Okay, go ahead and let it out. Take a second. We're going to do the same thing on this side. Breath in, out, and then hold it. Okay, go ahead and let it out. So at this time, I can say that I note that she has a brewery on the left side. So now we're going to assess the heart sounds. So just breathe normal for me. And I moved in 4 different areas so that we were able to hear if there's any inadequate ejections or anything throughout the heart, not just in one section. And I am going to auscultate lung sounds. So we will do a anterior and posterior lung sounds. I go top to bottom, left to right, so I can have an equal baseline, and I can see if there's any difference between the two sides. So right now I'm going to just listen to the anterior. Just take it. There you go. And now I'm going to go around the back. Breath in, breath out, breath in, out, in, out, in, out. One more. And last one. Okay. So at this time, we note some abnormal sounds in the lung, and that's going to be due to her past medical history. Past surgical history. She's diminished on I'm going to assess radial pulses, so you can do both of these ones at the same time. They are adequate, equal, bounding. Now I'm going to assess the skin color, make sure there's no bruising which she does have a little area here. It looks like it was a lab draw. Is that what happened?
From surgery.
From surgery. And you note there's some scarring here. And then I'm going to have her hold on to my hands and squeeze as hard as you can. So her bilateral grip is equal. She has nail polish on, so I can't really do a capillary check, but we would say that to check it, it would be normal, less than 3 seconds. So at this time, we're going to do an abdominal check. I'm going to auscultate for bowel sounds. I'll lightly palpate, but given that she just had stents put in her abdominal aorta, I can't actually palpate too well. So again, we're just going to listen for bowel sounds. So all bowel sounds are present, and this is when I would ask, when's the last time you had a bowel movement?
This morning.
So today, do you go normal? Do you have any issues?
Normal.
All right, so I'm going to palpate, which again, I'm not going to press real hard. Do you have any pain or discomfort?
No.
No. So for her own privacy and to be discreet, I'm not going to have her remove her shirt. For this part of assessment, I'm still looking at the skin throughout the whole entire body. I'm looking at her legs to see if there's any swelling, which you can clearly see that there's no swelling. No bruises, no lacerations, no open areas. So I'm going to remove her sock. And right here is where I'm going to feel for a pedal pulse. And they are good on the left side. And they are good on the right side. And we're going to feel for a popliteal pulse, and that's behind the knee. And that one's good. And that one's good. I'm going to assess Patty's gait and walk and balance. So Patty, I'm going to have you stand up and walk 3 steps, turn around and come back and sit down. Perfect. So her gait is adequate. She does not use any assistive devices. She does not shuffle, and her balance is good. We're going to show the incisional sites of where she had her part of her lung removed. So she has some scarring right here. And I'm going to feel. And she has a pretty decent sized one here as well. It's a little firm to the touch. She has one right up there. So multiple areas of incisional sites.
I think there's one under my arm.
So there's one there as well. All right. So again, she has no sub-Q emphysema, which is crepitus. There's none of that. So I'm going to look at her back real quick, and I'll show you. Real quick skin. There is no open areas, no lesions, and I believe that's going to be the end